Hearing no objection, Senator Lanny, you're recognized to begin the debate.
Thank you, Mr. President. Back, I don't know, I think it was sometime in 2021, I was watching the news and there was a news story, one of the local news stories about our public health districts, and they were talking. I wish I tried to find the reference. I couldn't find it today, but I remember vividly seeing it. One of the members of, I believe it was Central District Health, I could be wrong, but they were on like a local news station talking about the mask mandates and the lockdown, just all that stuff that happened during COVID. And they said, yeah, we've never done mask mandates before. We're used to like grading restaurants and things like that. So we didn't know if we were allowed to do mask mandates, but we went back and looked at the law, and sure enough, it said we can do all things. And I said, well, that's interesting. So they went ahead and did things. So this bill has to do with that, with public health districts, because in the wake of COVID, and you know, I know this sounds like a broken record from previous bills, but and with new potential pandemics on the horizon, trust in our health system has become paramount. So this bill simply seeks to solidify that trust by clearly defining the powers of public health districts. And it does that by doing something quite simple. It adds a crucial layer of accountability that's rooted in reason, necessity, and science. Because as Bob Dylan said, the times they are a-changin', and in a state where we hold individual freedom and restrained governance in high esteem, it's imperative that we establish boundaries, because in my view, I don't think any political subdivision should have the authority or power to do all things. So that's all this bill does. It says that our public health districts cannot do all things, but they can only do what is essential. Because yes, public health matters, but not at the cost of individual freedoms. And I don't think we should ever sacrifice our rights for perceived safety. And this bill is not just about limiting power or adding accountability. It's about reaffirming our rights, our choices, and our bodily autonomy. So with that, Mr. President, debate is open.